Bismillahirrahmanirrahim. My name is Dr. Imran Bakar. I'm Assistant Professor, Department of Pathology. Today I'm going to discuss healing of bone and osteoarthritis. Learning objectives. At the end of the lecture, you are able to understand what is the mechanism of healing of bone. What is osteoarthritis? Its definitions, its pathogenesis, morphological features, clinical correlation, and diagnosis. Now, what is healing? Bone healing refers to a complex and sequential events that occur to restore injured bone to pre-injury state. Then what is fracture? Fracture is a break in the structural continuity of the bone. Bone is unique in its ability to repair itself. It can completely reconstitute itself by reactivating processes. Bone repair is a highly regulated process that can be separated into overlapping histologic, biochemical, and biomechanical stages. Completion of each stage initiates the next stage, and this is accomplished by a series of interactions and communications among various cells and proteins located in healing zone. The healing of fracture is in many ways similar to healing in soft tissue wounds, except that the end result is mineralized mesenchymal tissue, that is bone. Now the question arises, what is mesenchymal tissues? Mesenchymal tissues are the multipotent stem cells which are found in bone marrow that are important for making and repairing skeletal tissues such as cartilages, such as bone, and such as fat and bone marrow. Bone healing refers to complex and sequential events that occur to restore the injured bone to a pre-injury state. There are two types of bone healing: healing by callus formation, which is indirect or secondary, and number two is healing by direct union. Now let's come to the stages of bone healing. Stage 1 is hematoma formation. This stage occurs immediately after the fracture. As you can see in this picture, stage 1, this is hematoma, blood clot at the fracture site. Whenever the bone gets injured, there must be a clot formation at the site of injury. The second step is inflammation and cellular proliferation. It takes 8 hours to 12 weeks. There might be the migration of many cells, for example inflammatory cells, for example macrophages, neutrophils, platelets. There might be elaboration of cytokines, growth factors, and other mediators of inflammation at the site of injury, proliferation and differentiation of mesenchymal stem cells, migration of fibroblasts, and the osteoclast cells. Now what is osteoclast? Osteoclasts are the cells that degrade bone to initiate normal bone remodeling and mediate bone loss in pathological conditions by increasing their resorptive activity. So basically these are the resorptive cells. They resorb, they mop up, they clean the injured bone and area to facilitate for the repair process, new bone formation. So these are osteoclasts. Osteoclasts have acid phosphatase enzyme which they can secrete that enzyme, and the purpose of that enzyme is to dissolve the organic collagen and inorganic calcium. The osteoclasts basically are the multinucleated cells that differentiate from another type of cell called a macrophage. So after that stage, इसमें proliferation and differentiation of mesenchymal stem cells हुई, migration fibroblasts हुए, osteoclast आए. After that stage, neovascularization, new vessel formation occur, and this stage is also mediated by a variety of growth factors, which we will discuss later. Now the third step is healing by callus formation. Now what is callus? Callus, bony or cartilaginous material forming a connecting bridge across a bone fracture during repair. It takes 2 to 3 weeks to 4 to 8 weeks to form a callus. Osteoclast mop up dead bone, as I have discussed here. Osteoclast से काम किया, it resorb the bone. The dead bone को उसने clear कर दिया at the site of injury to initiate the new bone formation. After that, collagen matrix formation. Now, what is collagen? Collagen is the main structural protein found in skin and other connective tissues. It has great tensile strength and is the main component of fascia, cartilage, ligaments, bones, tendons. Collagen is a protein which is made up of amino acids, which are in turn built up of carbon, oxygen, and hydrogen. There are certain specific amino acids present in it. for example glycine, proline, hydroxyproline and arginine. After that collagen matrix deposition, there is osteoid deposition and mineralization. Now what is osteoid? Osteoid is an unmineralized organic material, organic component of bone, eventually undergoes calcification and is deposited as lamellae or layers in bone matrix. It is made up of fibrous proteins and crystals of calcium and phosphates. After osteoid deposition, mineralization of the bone occurs. Mineralization is a process by which organic bone matrix becomes filled with calcium phosphate crystals. Process is mediated by the cell called as osteoblast and confined to the organic osteoid matrix produced by osteoblast. Basically, this is produced by osteoblast. Osteoclast resorptive cells and osteoblast are the bone forming cells. After that, woven bone is formed. You can see in that picture, woven bone फॉर्म होना शुरू हो गई है. वोवन बोन की टेंसाइल स्ट्रेंथ एक्सीलेंट नहीं होती, अच्छी नहीं होती, हैपहैज़र्ड अरेंजमेंट होती है और लूज बोन होती है वोवन बोन. बेसिकली वोवन बोन इज अ लूज बोन. ठीक है. सो नाउ नेक्स्ट पिक्चर. Our next stage is consolidation. Consolidation, it takes weeks to 2 to 3 months. Lamellar bone formation occurs in that consolidation phase. After woven bone, lamellar bone forms. Woven bones, what are woven bones? Woven bones are fibrous bones. I've already told you. These are mechanically weak ones. But as compared to the woven bones, lamellar bones are mechanically strong. There are sheets, and collagen and sheets formation occurs. Lamellas produce हो जाते हैं. ठीक है, ये आपको lamellas बने हुए नजर आ रहे हैं. तो ये now it becomes a lamellar bone. Remaining gaps filled by the lamellar. ये woven थी, remaining gaps को lamellar bone fill कर रही है. Last stage is the remodeling stage. 2 months to 2 years. It takes time. 2 months to 2 years depending on the bone. Guided by the stress exposure. Osteoclast cells are responsible. Osteoclast, I've already told you about the osteoclast. जब osteoclast mopping, cleaning, resorption करेंगे तो फिर new bone formation होगी. So osteoclast की responsibility होती है. These are bone resorptive cells and osteoblasts. These are the bone forming cells. Cells that form new bone are osteoblasts. Come from bone marrow and are related to structural cells. They have only one nucleus as compared to the osteoclast. They are multinucleated. They produce new bone called osteoid. Bone remodeling में जो है resorption होती है and replacement by the osteoblast. These are the things. तो इसलिए osteoblast को हम जो है remodeling units भी कहते हैं. ठीक है. So that is the end of the mechanism of healing of bone. Now come stages of bone healing. These are the stages as we have already discussed: hematoma formation, inflammation, callus, consolidation and remodeling. This is the diagrammatic view. Now we can come to healing by direct union. The first step is healing by indirect union by callus formation, which we have discussed. Now the second one is direct union. Occurs in fractures where ends are compressed with intervening space less than 500 microns. No callus formation. Gap healing occurs if space is 200 to 500 microns, and contact healing occurs if a space is less than 200 microns. Now there are certain factors which regulate fracture healing. Number one is transforming growth factor beta. These promotes and proliferates differentiation of stem cells. They stimulate collagen synthesis. I have told you about the collagen. What are collagens? ठीक है. Transforming growth factor beta basically multifunctional cytokines होते हैं and belonging to the family of transforming growth factors. Now platelet derived growth factors. They stimulate T1 collagen, type 1 collagen synthesis by osteoblast cells. They also stimulate osteoclast resorption. Bone resorption को भी stimulate कर रहे होते हैं. Third one is fibroblast growth factor. Fibroblast growth factor stimulates fibroblast proliferation and stimulates angiogenesis. Fibroblast cells basically synthesize extracellular matrix and collagen. Fibroblast proliferation होती है तो collagen synthesis होती है, and it plays a critical role in healing of bone. Now, insulin-like growth factors. Insulin-like growth factors stimulate bone collagen and matrix synthesis. They inhibit bone collagen degradation. Insulin-like growth factors basically stimulate bone turnover as it increases osteoblast numbers and function. So इनका काम बेसिकली क्या होता है कि ये ऑस्टियोब्लास्ट का नंबर और ऑस्टियोब्लास्ट का फंक्शन दोनों इंक्रीज कर रहे होते हैं. इट ऑल्सो स्टिमुलेट्स बोन रिजॉर्प्शन थ्रू अननोन मैकेनिज्म्स. Now, vascular endothelial growth factor, they stimulates angiogenesis. Basically, इनका मकसद क्या होता है, इनका पर्पस क्या है? They restore oxygen supply to tissues where blood circulation is inadequate, such as in hypoxic condition. And angiogenesis भी stimulate कर रहे होते हैं, blood vessels की maintenance कर रहे होते हैं. Now, bone matrix proteins, these are osteoinductive. Osteoinductive means जो कि induce करती हैं osteogenesis, bone formation को. Stimulate differentiation of osteoprogenitor cells to osteoblasts. ये differentiation osteoprogenitor cells को osteoblasts बनाने में मदद करती हैं, so they are osteoinductive as well. तो bone matrix proteins का function ये होता है. Now, cytokines, interleukin 1 and interleukin 6 stimulate bone resorption, chemotaxis and regulation of inflammatory cells. I think you know what is chemotaxis. Chemotaxis means movement of a motile cell or organism in response to any stimulus. So whenever the stimulus occur, for example injury हुई तो stimulus आया तो cytokine chemotaxis होती है, movement होती है, तो वहाँ पे motile cells की और organisms की जो inflammatory cells हैं. So this is chemotaxis. So these are the some regulatory factors. Now there are some systemic factors as well. Systemic factors: growth hormone acts via insulin-like growth factors. Thyroid hormone, they increase bone resorption by osteoclast. Estrogen, they minimize bone resorptions. Factors influencing bone healing. There are some local factors and local factors. Type of bone जो कि influence कर होता है bone healing को. Type of bone, which bone is injured, which bone is fractured. Pattern of injury, pattern of fracture क्या है? There are different patterns of fracture. Site of bone, which bone, site of injury क्या है? Soft tissue devitalization, blood supply कितनी injured हुई है, कितना blood supply damage हुआ, infection क्या हो तो नहीं हो गया, radiation, अगर infection होगा तो उसमें bone healing में delays हो सकती हैं. Systemic factors, malnutrition is a systemic factor that delays healing. Diabetes mellitus, if patient is diabetic, the bone healing delay हो सकती है. If patient is on drugs, for example, NSAIDs, steroids and cytokines. If patient is a tobacco user, if patient has some thyroid disorder, if patient has some vitamin deficiency, if patient has some CNS trauma, if he is infected with HIV. Now come to osteoarthritis. Basically, osteoarthritis definition. Osteoarthritis is a degenerative disease. What is degenerative? Disease of synovial joints characterized by focal loss of articular hyaline cartilage with proliferation of new bone and remodeling of joint contour. Degenerative means deterioration. Tissue deteriorate and lose its functional ability due to injury, due to aging, and due to any wear and tear. What is synovial joints? Synovial joints, there are different types of joints. So what is synovial joints? I think you know what are different types of joints. Those synovial joints are the joints that allow the smooth movements between the adjacent bones. The joint is surrounded by an articular cartilage that defines a joint cavity filled with synovial fluid. Shoulder joint, hip joint, knee joints, elbows, these are the example of synovial joints. Epidemiology. Weight-bearing joints, for example, knee and hip joints are most commonly affected in osteoarthritis. Greater than 65 years of age में osteoarthritis के chances ज़्यादा होते हैं. 80% have radiological features, 25-30% have symptoms, more common in women, and it has a familial tendency. Etiology, there are two, primary and idiopathic. When there is no obvious predisposing factor for osteoarthritis. Osteoarthritis appears as an aging phenomenon. With the progressive age, osteoarthritis can develop in these joints, synovial joints. Common form of osteoarthritis is primary and idiopathic. In primary and idiopathic, mostly radiographic features measure. Secondary osteoarthritis. What is secondary osteoarthritis? Secondary means which result from some predisposing conditions. that has adversely affect the joint tissue. When degenerative joint changes occur in response to a recognizable local or systemic factors, these are second. So these are the list of diseases that causes osteoarthritis. In the secondary to these diseases, osteoarthritis can occur. Number one is hip dysplasia. What is hip dysplasia? Displacement of the hip joint. Hip joint have a socket in which the head of the femur is attached or placed. So it will be displaced due to some anomaly. Congenital defects भी होते हैं. So hip dysplasia is one which can lead to osteoarthritis. Acromegaly, endocrine. Acromegaly. Acromegaly क्या होती है? It's an hormonal disorder. Hormonal disorders that develop when your pituitary gland produces too much of hormone during adulthood. It can lead to arthropathy. Arthropathy means which one the disease which resembles osteoarthritis. Disease of a joint is arthropathy. Arthropathy. So it can lead to osteoarthritis. Traumatic, intra-articular fracture, occupational disorders, inflammation, rheumatoid arthritis. Long-term autoimmune disease होती है that primarily affect joints. Most commonly, wrist and hands are involved in osteoarthritis. Gout. Gout is an inflammatory arthritis that is very painful and usually affecting one joint at one time. Big toe is the most affected joint in the gout. Septic arthritis, infection. Infection in the organisms comes in the joint through the bloodstream. So septic arthritis हो सकता है. Metabolic, alkaptonuria. Alkaptonuria is a genetic disorder characterized by accumulation of homogentic acid. It's in the body. This is alkaptonuria. It can lead to osteoarthritis. Wilson's disease. Wilson's disease is deposition of excess amount of copper in the liver, brain, and eye. Now, aseptic necrosis, corticosteroid uses, systemic lupus erythematosus, sickle cell disease, neuropathy means syringomyelia. Syringomyelia is a disorder in which cyst or cavities develop within the spinal cord and it leads to paralysis. Diabetes mellitus, Paget's disease and Gaucher's disease. Paget's disease in which infections which interferes with your body's normal recycling mechanism and which new bone tissues gradually replace the old one. And next one is Gaucher's disease. Gaucher's disease is a disease fat-laden Gaucher cells build up in areas like the spleen, liver, and bone marrow. So this is Gaucher's disease. These are the conditions which can lead to osteoarthritis. The osteoarthritis occurs secondary to these all conditions. This is secondary osteoarthritis. Risk factors. There are certain risk factors, constitutional and mechanical. Constitutional factors may hereditary osteoarthritis, gender, in females are common, hormonal status, obesity, high bone mineral density. High bone mineral density means when the bone mineral density is usually greater than 2 standard deviations, above 2 standard deviations, which is expected for age. So high bone mineral density किसी वजह से हो जाए, so that can lead to mechanical factors, trauma, alignment, joint shape, occupational usage. So these are the risk factors which can eventually lead to the chondrocyte apoptosis, proteoglycan loss, collagen fluid fibril damage, and osteoarthritis. This is a chart. This is in chart form. Pathogenesis. Osteoarthritis is not viewed as a dynamic process, but episodic progress. Is now viewed. Chondrocyte dysfunction leads to metalloproteinase enzyme release, causing collagen and proteoglycan degradation. Synovial inflammation is present with production of cytokines such as interleukin-1 and TNF that also induce metalloproteinase production. Metalloproteinase enzymes, they break down proteins such as collagen that are normally found in spaces between cells and tissues. So this is the enzyme which break down collagen. These enzymes require zinc or calcium atom to work properly. तो मेटालोप्रोटीन एंजाइम के अंदर जो है कैल्शियम और जिंक भी मौजूद होते हैं. मेटल एंड प्रोटीन है और मेटल भी ऐड है, जिंक. So they can break down collagen, which is normally present. Synovial inflammation is present with production of cytokines such as interleukin-1 and tumor necrosis factor A that also induce metalloproteinase production. Synovial inflammation means cytokines produced where these that induce metalloproteinase production. ये enzyme को और बढ़ा रहे होते हैं. Chondrocyte activation with the release of pro-inflammatory cytokines, interleukin 1b, tumor necrosis factor, matrix metalloproteinase, strolomycin, MM3 can follow mechanical stimulation of cartilage, and there is evidence for elevation of collagen 1, collagen S2, collagen S3 in osteoarthritic human cartilage. So basically, these all factors can damage the normal cartilage, articular cartilage. Local growth factors, especially transforming growth factor, are involved in the formation of osteophytes. Their osteophyte formation occurs at the joints. इसमें transforming growth factor can play a role. I will show you the pictures. Now, these processes that affect articular cartilage, subchondral bones, synovium, capsule, ligaments. Ultimately, cartilage degenerates with fibrillations, fissures, ulceration, full thickness, loss of joints occurs. This is a normal bone, and this is an osteoarthritic bone. Weakened and frayed muscles, thickened capsule, episodically inflamed synovium, reduced viscosity of synovial fluid, frayed and cracked meniscus, weakened and frayed tendons, that ligaments, fibrillated and destroyed cartilage, and the bone. Morphology. Gross morphology. Articular surface is soft with dislodged fragments of cartilage and subchondral bone forming loose bodies, which is called as joint mice. It occurs in the articular surface. Exposed subchondral bone is burnished by the opposing degenerated articular surface, bone eburnation. The exposed subchondral bone होती है, उसके ऊपर opposing degenerated articular cartilage आ जाती है, then it leads to bone eburnation. Small fractures allow synovial fluid to be expressed into the subchondral bone to form cystic spaces. Synovial fluid जो subchondral bone में आ जाता है, इसकी वजह से cystic spaces बनती हैं. Bony overgrowth osteophytes capped by cartilage also develop at the edges of the articular cartilage. Heberden's nodes are osteophytes of the distal interphalangeal joints, and it is common in women mostly. Microscopic morphology. Early osteoarthritis, there's chondrocyte proliferation with increased matrix water and decreased proteoglycan content, followed by fibrillation and cracking of the matrix. Synovium is mildly congested with a scattered chronic inflammation. Clinical findings. Mechanical pain, which occurs on activity and it relieves by rest. Morning stiffness, crepitus, limitation of range of movements, tenderness in joints, impingement on spinal foramen. Osteophytes, they can impinge and produce pressure effects on spinal foramina, which results in cervical and lumbar nerve roots compression, and radicular pain leads to muscle spasm, muscle atrophy, and neurologic deficits. Commonly involved joints are the hip joint, the knee joint, the lower lumbar and cervical vertebrae, proximal and distal interphalangeal joints of fingers, first carpometacarpal and first tarsometatarsal joints of feet. There are still no satisfactory means of preventing primary osteoarthritis, and there are no significant methods of halting its progression. It is a slowly progressive disease. Diagnosis. Osteoarthritis is a clinical and radiological diagnosis. MRI may be better at identifying early loss of articular cartilage, but this and other imaging modalities have not been well validated for the evaluation of osteoarthritis. Synovial fluid analysis may be helpful to exclude other causes of joint pain such as pseudogout. In general, some lab tests are not useful in diagnosing osteoarthritis. It is usually diagnosed using someone's personal and family medical histories. Tests may be ordered to rule out other conditions. Rheumatoid factor and cyclic citrullinated peptide antibody (CCP). This is done in routine. Synovial fluid analysis, CBC, CRP, ESR. ESR erythrocyte sedimentation rate होता है. C reactive protein is CRP. Simply blood count is CBC. Evaluation of liver and kidney functions. This is a diagram which has shown some osteophytes, joint space narrowing, bone cyst, subarticular sclerosis. These things will be discussed in X-ray findings. Now radiology, radiography. Calgren and Lawrence develop a classification system that set out a series of radiological features that are considered evidence of osteoarthritis. They divide the disease into grades. Grade 1, doubtful joint space, narrowing and possible osteophytic lipping. Grade 2, definite osteophytes and possible joint space narrowing. 3, moderate multiple osteophytes, definite joint space narrowing, some sclerosis, possible bone and deformity. Grade 4, large osteophytes, marked joint space narrowing, severe sclerosis, the definite deformity of the bone ends. Uneven osteoarthritis, X-ray progression, doubtful grade 1, grade 2 and grade 3, joint space narrowing. This is grade 4. Now this is osteophytes. These are osteophytes. Let's see. Reduced joint space. Sclerosis, hardening and thickening of the bone. Sclerosis is abnormal increase in density and hardening of bone. Now, this is cyst and loss of joint space. Osteoarthritis of a spine. This is the normal one, healthy spine. This is the abnormal one. You can see what is the difference between the normal and abnormal one. Narrowed disc, intervertebral disc space, narrow vein, bony spurs formation of vein. This is not present in normal. So this is all about the osteoarthritis and healing of bone. Thank you so much